you know about 95% of the world's population is naturally immune to leprosy? Once diagnosed, a person is easily cured. That's our focus today on Sound Health. Welcome to the program. I'm Olasumbo Modupe. We'll be right back after this short break.
Going by the World Health Organization's Global Health Observatory Data Repository, no fewer than 212,000 persons were newly affected by leprosy globally in 2015. According to the statistics, Nigeria is third among African countries with the highest burden of leprosy. Other African countries with the second highest burden of leprosy are Democratic Republic of the Congo, DRC, with 4,237 cases, and Ethiopia, 3,970. Recent report shows that the country relapsed after the achievement of being delisted from the list of endemic nations with leprosy in 1999. Leprosy is an infectious disease of the skin and nerves. If not diagnosed and treated quickly, can result in disabilities. The effects of leprosy is made worse by the negative stigma surrounding the disease. In 2015, over 210,000 people were diagnosed, and it is estimated that millions more go undiagnosed. This, medical experts say, has given room for the neglected tropical disease to stage a comeback with a high prevalence rate in the country. At the commemoration of the 64th anniversary of World Leprosy Day with the theme Zero Disability Among Children Affected by Leprosy, the Minister of Health, Professor Isaac Adewale, disclosed that leprosy still posed a challenge due to the pockets of high endemicity in Jigawa, Kano, Kaduna, Kebbi, Bauchi, Taraba, Niger, Kogi, Ebonyi, Abia, Cross River, Edo, Osun, Ogun, and Lagos states.
Today on the program, Dr. Ibidunni Bode Sojobi, a clinical microbiologist and infectious disease physician with Lagos University Teaching Hospital, will talk on stigmatization, early diagnosis and treatment of leprosy. Welcome to the program, Doctor.
Thank you so much for having me on the show.
What is leprosy, Doctor, and what causes leprosy?
As we all know, leprosy dates back to biblical time. If you can remember in the Bible where the lepers were sent out of the village, more or less isolated. So leprosy is actually a chronic condition that is caused by a particular microorganism, or let me use the word germ, Mycobacterium leprae. That's what causes leprosy, but it's a chronic disease that takes a while before you can actually see the manifestation of the disease.
Are there types of leprosy, and what are the symptoms?
There are different types of leprosy. We have what we call paucibacillary and multibacillary. Basically, in terms of those words that I've just used, we're talking about in relation to the clinical manifestation or clinical symptoms that the patient will show. So those that have paucibacillary, their lesions are actually fewer compared to those that have multibacillary. And the signs and symptoms varied depending on an individual, but the earliest one that usually seen are actually skin manifestation, because this Mycobacterium leprae that causes leprosy that we'll talk about actually affects skin and nerve endings. So usually what we see is areas of hypopigmented areas on the skin, meaning a part of the skin that is lighter than the other part of the skin. And in those areas, if care is not taken, usually an individual might notice loss of sensation. The feeling there might be reduced. Also, in some instances, sweating around that particular part is reduced compared to the other parts of the body. Those are the early symptoms of leprosy that patient can present with.
Okay, is it contagious, and what is the mode of transmission? Because people's the normal myth is leprosy is contagious. Is it contagious?
With any infectious disease, they have different mode of transmission. Leprosy is contagious, quite all right, but it is curable. So in terms of transmission, it is transmitted via respiratory droplets of somebody that has leprosy or prolonged contact with somebody that has leprosy. When I mean contact, I mean skin to skin. When we use the word contagious, we have to be very careful, because when we talk about infectious diseases, they have different modes of transmission. So in terms of being contagious, leprosy is contagious. How is it transmitted? It can be transmitted via droplets. Basically, somebody that has leprosy, they secrete their secretions, mainly mucus, saliva, that is dropped. Another person can pick it up from there. Also, prolonged contact with somebody that has leprosy. Those are the ways of transmitting the infection.
Are there other complications with the disease?
Well, there are, but if presented early, the complications will not be seen, because there is treatment for leprosy. It's not a terminal disease. Okay. Yes, there is treatment for it. So there are complications, late presentations. You see those complications in those that are presenting late, meaning loss of limbs. Sometimes blindness can occur as a result of that. You've seen people losing their hands, their toes. It's because of late leprosy. If they are treated early, they won't have all those complications.
Okay. What are the treatment options, and are the treatment centers accessible to people living with the condition?
Good thing about leprosy, unlike what we had in the biblical time, is that now we have treatment for leprosy. So basically drugs. There are different drugs that can be used in treating leprosy. Though the drugs, they have to be used for quite a long period of time. We are talking about 9 months to 12 months. But once treatment is strictly adhered to, the person at the end of the day can be cured of the disease. So we have rifampicin. There is a guideline, WHO guideline, recommends dapsone, rifampicin, and then clovarsimine. It actually depends on the type of leprosy that the person has. But it's not for an individual to say, oh, I think I have leprosy, and then for them to start treating themselves. We have centers that actually been designated for treatment of leprosy in the country that they can present at, and they will get the best care available.
But are these centers accessible?
Definitely they are. They are. We have them in different states. Usually the tuberculosis and leprosy program, they go together. So if somebody where they can access treatment for tuberculosis, treatment for leprosy can also be assessed at the same center. It's just that the diagnosis has to be made properly before they can be referred to such center for treatment.
So Nigeria tops the list of countries with cases of the disease. How did we get here, and what is the way forward? Because in 1999, the country was delisted from the list of countries with prevalence. Why do we have the prevalence now? Why do we have the relapse?
Basically, one problem with leprosy is the stigmatization. If people present early, you can imagine an individual that has leprosy and they know that, oh, what happened then for anybody that has leprosy, they have to be sent out of the community. They won't want to present early. But in this situation, if we have early presentation, treatment can be given, and at the end of the day, the person will be cured of the disease. Even those that are presenting late, they can still receive the treatment and be cured of the disease.
Is there a cure for the disease, doctor?
Certainly, drugs are available for treating leprosy. It is curable. It is not a terminal disease. Gone are those days that there was no treatment. Now we have treatment. The issue of isolation is more or less enhancing the stigmatization. And you know, when people know leper community, no individual wants to be associated with that kind of community. So in terms of welfare and quality of living, even the children that are being given birth to, quality of education they are going to receive, to be integrated into the society will be a bit difficult, because they know they are coming from a particular community.
General consensus is that lepers must be isolated in the society. What is your assessment of their welfare?
In all honesty, I've never been to lepers community, but it's something that one can easily reason out. These are people that are isolated, and you know the stigmatization that we talk about. When people know that these people are coming from lepers community, they are going to move away from them, nobody will want to go into such community. So in terms of living condition and welfare, definitely you cannot compare it to what you have in you and I, that we can easily move freely in the society.
What are the tips for management of the disease?
One thing is certain: early presentation. Once anybody notices any of the symptoms that we've mentioned, area of hypopigmentation on the skin with reduced feeling or reduced sweating, it is better for them to present at the nearest healthcare facility. Once that is done, you can be rest assured that everything is going to be history because drugs are available.
On a final note, what is your medical advice for people living with the condition and members of the public?
Okay, number one thing that I have to debunk is that leprosy is curable. The drugs are readily available. We have the leprosy unit in the Ministry of Health that the drugs are readily available. So anybody that has leprosy, or you know of anyone that has leprosy, advise them to present early. Early detection, right treatment, and you can be rest assured that the disease will be cured.
Thank you so much, Doctor, for your medical insights on the show. It was really an eye-opener.
Thank you.
That was Dr. Ibidun Shojobi, a clinical microbiologist and infectious disease physician with Lagos University Teaching Hospital, on stigmatization, early diagnosis and improved treatment of leprosy. Up next is Trending. Please stay with us. We'll be right back.
Bioabsorbable stents.
Coronary artery disease is the most common disease in the U.S. and accounts for the most deaths per year. Common to treat the disease is a 1-hour procedure in which a widening stent is placed into the blood vessel. Most of the time, stents stay in a patient forever, long after its mission is completed. These mostly metal stents can make some scans and future surgeries difficult and can cause a patient possible complications. What if they could just disappear? The first bioabsorbable stent has been approved in the U.S. The stent, made of a naturally dissolving polymer, widens the clogged artery for 2 years before it's absorbed into the body, in a manner similar to dissolvable sutures. This innovation has experts suggesting a $2 billion market in the next 6 years.
Alright, that's Sound Health this week. For comments and inquiries, please send SMS on 080-35826603 or follow us on social media at LTV Social, #SoundHealth. From me and the rest of the crew, thank you so much and join us again next week for another episode. I'm Modupe. A sound health is a sound mind. Make healthy living your choice.